right, a warm welcome to you from Geneva, Switzerland. I'm Revati Phalkey in Geneva, and you're going to hear and maybe even see Charlotte Mbou from Eboloa, Cameroon. How are you doing, Charlotte?
I am doing great, Reda, and it's a real pleasure to connect today for this lightning chat.
Indeed, we're here with Revati Phalkey from Save the Children. We're going to talk about her long-time commitment. She's really a pioneer around these questions of climate and health. Now, we still don't have a card for you, Maria, that we can show a photo, but we'd love to hear you introduce yourself. And of course, many at Teach to Reach have been in touch with you because you're our partnerships coordinator. How are you doing? And tell us, what is the weather like in Argentina? I believe you're in Buenos Aires this week. How is it?
Thank you, Reda. Hi, y'all. Hi, everybody. Thank you for being here. I'm in Buenos Aires. It's cold weather, so not very good for my voice, but we'll make the best out of it. But I'm very happy to be here and very excited about listening to Revati on these amazing themes that we're going to cover in the next few minutes. So back to you, Rita.
And we're counting down. You can see we're 1 minute, 25 seconds away from getting started. And this is one of a series of lightning chats. If you go, I'm going to show you our YouTube channel, but you can already go there and see and hear the lightning chat we recorded with Toko Elfikpuli. She is the CEO of Uniting to Combat Neglected Tropical Diseases. Uniting is a Teach to Reach partner for this edition. Very pleased to announce that partnership. Coming up are lightning chats with Maria Nera from the World Health Organization. And I believe, Revati, you were just with Maria and many other colleagues at the World Health Assembly. We're hoping to dig into that a little bit. Kate O'Brien, who is the Director of Immunization at WHO, will also be coming in. Let me just check on the time. And we're about 30 seconds away from getting started, so I may not tell you all the amazing global leaders who will be coming in these lightning chats. David Akpan is another valued Teach to Reach partner from eHealth Africa and EHA Clinics. And then our first fellow of climate change and health, Luchuo Ibain, will be coming in to talk about climate change and decolonization of global health, but also to listen and to learn from you. I believe it is... Okay, we're 7 seconds away. Here we go. All right, a warm welcome to you from Geneva, Switzerland. I'm Revati Phalkey. I'm here with Charlotte Mbou and Maria Manzan, and we are here to speak with Revati Phalkey. And we, as you know, with the lightning chat, we're here with leaders of the Teach to Reach a community, and we're going to dive right in. We dispense with introductions, with all the formalities, and Maria is going to ask you, Revati, the first question.
Thank you, Rita. Okay, so Revati, Dr. Martina Isiama from Nigeria recently shared with us that there was so much heat that people could not sleep well at night. People who could afford air-conditioned houses, they'd enjoy life, while others who could not continued to endure the heat. People were not looking healthy, and cases of malnutrition and anemia increased. So the World Health Assembly's landmark resolution on climate change and health comes at a time when frontline health workers are already grappling with devastating impacts. So our question is, how can the World Health Assembly's resolution on climate change and health translate into effective local action that leverages the insights and experiences of frontline health workers?
Yeah, thank you very much, Maria, for that question. And I would like to say, first of all, thank you for having me and having insights from Save the Children being shared on this excellent platform. And congratulations to Reda and the Geneva Learning Foundation team for putting together such a platform for for us to interact with colleagues like yourselves and learn from all of you. I will begin with saying that yes, we have the resolution, but that is just the first step, because that is just one of the policy frameworks that in the last 2 years have really accelerated quite a lot in terms of, we having the declaration, the COP28 declaration that came last year. We have now the first climate and health resolution revision. This is the first time it has been revised after the 2008 resolution. So this is just the first step. And as we all know, for resolutions to become concrete actions and to be operationalized on the ground, there are two essential steps, right? The first one is, of course, that all of these resolutions, there were 12 resolutions which were passed at the World Health Assembly the week before. And one of them was, of course, climate change and health. So each of these resolutions will be followed by a global plan of action. And that's the bit which basically operationalizes the ambition that has been set up in the resolution. So the first step is, of course, to have voices of frontline workers represented, but more than, kind of hearing filtered information, I would even say hearing directly from frontline healthcare workers, particularly at the community levels, which are, as you mentioned, are facing the first kind of line of response for not just understanding the impacts, but also responding to them, getting these voices into the planning mechanisms. And the planning mechanisms, not just at the global level, because the resolution is basically culmination of everything that happens from the national levels, and then the other way around. So I think at every level, all parts of the healthcare professionals, from community to the ministry levels, need to be vocal about how they want to see the ambitions in the resolutions being operationalized. That's one bit. The second bit is, of course, to advocate for the resources that will support these global in witnesses of. So frontline health workers, particularly community health workers, are the people who sense support the health system in detecting, confirming, recording, and reporting how health patterns are changing with the patterns of weather variability and climate change. So the second bit is to use all of that information to also advocate for adequate financing that will go into the support of the global plan of action. And as I mentioned before, it has to happen from the subnational levels to the national levels to the regional levels to the global levels. Co-design and co-development of this global plan of action is an important step in this whole process. The second thing I would say is to synergize these resolutions. Yeah. So we are talking about the climate change and health resolution, but there's another important one which was passed at the WHA in Geneva, was the one on maternal, newborn, and child health. Addressing the mortality targets of SDG 3.1 and 3.2. Now, these two are probably the, alongside others, like all the other 12 will also have links to this resolution, but this one is the closest one. So how do we optimize the work on these two resolutions, which will bring us the maximum benefits, the maximum support, the maximum leverage for action for both climate change as well as maternal and child health? Because as we know that children are frontline of this, 1.2 billion children are living in areas where highly susceptible to suffering. I will
Revati, you're breaking up, but I do have a question for you, which is the following. Revati, are you able to hear me? Yeah. So yes. I would like to ask you, so you were at the World Health Assembly. Yes. And so my question is, all right, hang on. Let me just stop the whiteboards. Yeah. Here. All right. So I've got a picture up on screen. Everyone seems to be smiling. Maria Nera, the Director of Climate and Health at WHO HQ, is in the middle. You, I believe, are 1, 2, 3, 4, 5, 6 from the right-hand side. Can you tell us what is this moment that has been captured in this photography that you shared, I believe, on Twitter, X, or on social media? What's going on here? What is significant about this moment?
So I'm GPM on the day the resolution was passed. I had the pleasure of delivering a constituency statement on behalf of 10 other civil society organizations.
Yeah, you're still breaking up. If there's a way for you to improve your Wi-Fi
After
connection,
the
I've turned off your video, but we really need you to improve your Wi-Fi connection. Otherwise, it's going to be difficult to have a dialogue with you that we're hoping to have today. Is if there's anything you can do. But let's start by persistence. You were beginning to break up when you started to tell us what is happening in this picture. The resolution for climate and health at the World Health Assembly has just been passed. Who are in this? Who is in this group of people?
So, of course, you see Maria in the white dress. Next to her, in the black dress with the name tag hanging, that's Elena Villalobos Prats. She is the head of the ATTACH program at the WHO Geneva office. Next to her is Diamid Lendrum Campbell, who most of you must be knowing. He has 25 at climate change work, and he's the head of the climate change division within the Department of Environment, which Maria leads. And next to me, the lady in the white shirt is Alexandra. Alexandra is also from the HQ in Geneva office, and she is basically supporting all of the partnerships and policy advocacy work for climate change and health at the headquarters.
I'm sorry, I didn't mean the complete inventory, the complete list, but just to give us a sense of who the people are who came together in Geneva for the World Health Assembly. I believe you're still having trouble, and there's probably a delay in you hearing me. So if you can keep that in mind, you will hear me probably 1 or 2 or even 3 seconds after I speak, which is, but basically, I have another photo from your social media to ask you about before we go on with the questions. I mean, obviously, working at the global level, your explanations are valuable, but there's also a human side to the work that you're doing, and that's why we wanted to share with you these photos and ask you about them. So this is, I believe, also in Geneva. Can you tell us who you're with here and what the significance of the moment is that you shared with the world on social media?
German embassy. As you know, that Brazil, Norway, and Germany have been quite supportive of child participation and inclusion of children in the spaces where climate and health is discussed. And this was the event in which we talked about policy to action. To my right is Zevi. She was our climate champion who gave an outstanding talk about what do they see as children in terms of what kind of climate action they are expecting to see from the policymakers. And to my left is Margot. She is our head of policy and advocacy in the Geneva office, who basically drives all of our policy advocacy work for the WHO, but also member states.
All right, wonderful. You mentioned the voices of health workers. As you know, Revati, last July, 4,700 health workers came together, shared their observations, answered questions such as this one: is climate change a threat to the health of those you serve, and why do you think that? Most of the health professionals who responded are trusted advisors to communities. They see themselves as part of the family or a trusted friend, as you can see here. And when we ask 1,234 of them across both Francophones and Anglophones, you can see on this question, climate change, on this statement, climate change is a threat to the health of the community I serve. Most people actually assigned the highest threat level of 4 or 5 on the scale of 0 to 5. And then when we ask, do you worry as a health professional about climate change? Again, you can see most people assign the highest threat level. This led us to choose the main theme of Teach to Reach 10 on the 20th and 21st of June to be really this dialogue, sharing of experience that began last July for the Teach to Reach community on the front lines of climate change. And that leads to the next question, which is going to come from Charlotte.
Thank you so much, Reda. So, Revati, We have Iroma Chinedu Ofotude from Nigeria, who recounted the story of a pregnant woman in labor during floods. Unfortunately, he says, they couldn't get a strong boat or canoe that could stand the high currents and waves coming from the seaside. In the process of searching for a better means of taking her to the nearest health center, she got exhausted and died. Many health workers in the in the reports that we get described feeling heartbroken or overwhelmed by the climate-related suffering they are witnessing. So my question for you, Revati, is what message would you share with health workers overwhelmed by climate-related suffering, and how can we support them to build resilience?
Yeah,
Thank you.
Thank you for that question, Charlotte. And I think the first thing to do is to, encourage healthcare workers in the front lines to accept, to process, most importantly, and, in their own way or with support, manage these emotions, because this is the long haul. We are in it for the long haul, and it is going to, kind of worsen with climate change. So having building the resilience will mean that healthcare workers also appreciate and acknowledge their own well-being in this space, because the better they manage their own emotional well-being and mental well-being, the better they will be able to support communities in more increasingly more difficult situations. And I think that most community health workers or frontline health workers do often play the role of a virtuous soldier, right? Putting work, putting families ahead of themselves. So I think that would be my first message. The second message would be, of course, to document to the best of their abilities the difficult situations in which they are operating, and then making this information available to the right ears of the decision makers in a format that resonates with them. And I think that, platforms like Teach to Reach, similar others which are in the process of being established by the WHO, WMO, are offering opportunities for healthcare workers to bring forward these examples at scale. The second thing I would say is to also establish communities of practice where, and this has to happen obviously at the subnational, national, and the global levels, and Teach to Reach is a fantastic example of that. I can give you an example of what we are doing at Save the Children. We are an accredited agency of the Green Climate Fund, and we hold the first ever climate and health project funded by the Green Climate Fund. And what we are doing now to avoid practitioners to kind of reinvent the wheel, we are establishing a community of practice for countries which are developing these large scale projects, and bringing in examples like this and evidence that supports what the design of these large scale projects should be like. So having these communities of practice where they can openly communicate their experiences, learn from each other, exchange information, and generate collective knowledge, I think would be the best foot forward. And also using all of this information to advocate for change in what exactly do we need to enable that particular example that you use, to enable the healthcare workers to kind of find better solutions in the available resources. I think that's the way forward.
Thanks, Revati. There is an issue that we have found when presenting or sharing individual case studies and really lived experience. And in global health, we have found quite a strong resistance, in fact, and a kind of dismissal of lived experience of health workers and communities as anecdotal evidence. So in principle, everybody loves to, is really sympathetic to people who are on the receiving end of the harshest effects of climate on health. But when it comes to actually listening and learning, there is that skepticism about the value of lived experience. For you, what is that value? And to a decision maker or funder who says, well, this is all very interesting, all these really nice stories, but what we need is quantitative causal evidence of relationship with of climate impacts on health in order to
Yeah.
inform policies and actions. What's your response to that decision maker or funder?
Yeah. So thank you very much. So I do come from a strong epidemiology background, and the principles of public health, at least academically, do somehow ingrain it amongst us that that evidence is more skewed towards quantitative assessments rather than mixed methods, which is what we should be looking for. So I would say my first argument to counter this kind of thinking is that adaptation is all about localized and contextually grounded responses. So being dismissive of first line experiences which are described qualitatively, I think that is counterproductive, because whatever else, these examples, these narratives, these qualitative accounts from either healthcare workers or from populations and communities themselves, these are the people and the faces behind the data. So making this information, real life experience, available to policymakers, it definitely, in my experience, adds value to the quantitative data that is presented to them, and they are kind of inclined to make decisions on. And then the second bit is that quantitative data alone is not going to let them design solutions that are going to be accepted at a level that the community would, in case when they are part of that, engaged in that co-design and providing their own perceptions, expressing their needs, and adding that value to those numbers in terms of how we can process actually the quantitative data. And of course, participatory community engagement with frontline case studies is foundational to Save the Children's work. It helps us create a shared understanding of the complex health, climate, wash, nutrition relationships, but it also enables us to identify or kind of almost co-prioritize interventions to then support better uptake of them. So I can give you an example of a participatory mapping exercise, which we have done in Somalia for drought and malnutrition for climate, in Vietnam for the dengue risk, and in Colombia for food security. And this is a fantastic example of bringing close national and subnational government authorities, civil society organizations like ours, community health workers, bringing in, kind of that understanding of that data, to then say that, okay, this is how we understand the impacts, and this is how the causal loops are for how the pathways to impacts are. Even if we are not able to quantify, even if we are not able to attribute them, this is where the solutions lie, and this is where our low-hanging fruits are for interventions. So I do see immense value in bringing this information into the processing of the quantitative data that is much required or demanded by colleagues.
Great, thank you, Revati. So we have a first a question from Nduka Ozor. I'm going to put it up on screen, and we're going to invite him to introduce himself and also ask this question. So he says, a lot of countries have not formally integrated climate change and health. This means that there's no adequate platform to lead all the policies and procedures of climate change and health in the countries. How do we make this happen is his question. Let's first have an answer from Revati, and then Nduka will come back to you.
Yeah, so thank you very much. I think this is a symptom of the governance structures that have been traditionally established. Even if we look at the national adaptation programs, just yesterday there was a paper which was launched by a colleague of mine here in Heidelberg, who looked at 160 national adaptation policies across countries, and this was one of the findings, that only 22 of them were like health national adaptation plans, and all of them were developed by ministries of environment. So I do see, could you put back the question on the screen so that I know if there are any nuances? Yeah. So I think in terms of offering that adequate platform for conversations to happen at the national level, I think the interministerial dialogues are quite important. And of course, it depends on which level of health care workers will have a voice that can be represented there. But more importantly, this does have to happen at the subnational level and the community level as well, because unless we have to approach it top to bottom and bottom to up, because unless both these sides are pushing for a cross-sectoral, cross-ministerial conversation, it won't happen. And then the second thing is always to bring the social determinants of health argument, right? Unless that is happening, we are not going to be able to have the structure, the governance structures, and the spaces being made available to colleagues to discuss, climate space and health space. And I'll end with saying one thing, at least at the global level, a lot of organizations, including ours, is pushing for this dialogue to happen. As you know, the COP28 declaration happened at COP, that is in the climate space. The Bonn Intersessionals are happening in the climate space. We had this expert dialogue on climate and climate impacts on children. That happened in the climate space in UNFCCC. But the resolutions are all happening in the health space at the WHA. And I think it's organizations like ours which have the mandate and the responsibility to join these two conversations up and bring a better coherence in how we are approaching the roadmap for what solutions should be identified.
And Duka Ozor, would like to ask you to introduce yourself. I believe you may have done so before we went live, but please tell us who you are and why you asked this question about the way that countries are integrating health into their plans and so on.
Yes, my name is Mr. Nduka Ozor. I am here in Nigeria. I am the project director for an NGO called Center for HIV/AIDS and STD Research. Truly, I give you an example of what happens in my country, Nigeria. We have the Federal Ministry of Health, we have the State Ministries of Health, and then we have the local government. These different layers of government develop policies and directions to follow on any kind of intervention at the health level. So climate change and health has not actually been integrated. If you go to many states, there is no desk officer. There is no particular directorate that we can say this is for climate change and health. But for other diseases, we have it. And I think it is important that we have all these systems in place for policies and giving directions to interventions in those areas. That's what I'm talking about. Thank you.
Thanks. All right, let's go to Maria now, who has a question of a different nature. Maria? All right, and I think Maria may have had connectivity issues. Yes, and tried to send me a message. So, Charlotte, are you able to share the question that Maria had planned to hope? I think you're having connectivity struggles too. So health workers also share stories of hope, of community resilience, and local action. So one example came from Mpenza and Dagoniwa Philemon from the DRC, from the Democratic Republic of Congo. And this was with a total of 50 people, 10 circles of 5 people each. We've organized ourselves to raise awareness in the community and explain to them the dangers we face due to the behaviors of environmental disrespect. At Teach to Reach, health workers are already sharing promising community-led solutions. And so my question for Revati is, who do you think should be listening and why?
Yes, so I would say that everybody who is interested in achieving impact at scale should be listening. Because just, the model that you explained, it can very quickly accelerate into a global movement, potentially. And getting that information flow through the networks. Right now, we have pockets of networks that are being established. They may or may not overlap. They may or may not talk to each other. And they may or may not have the same mandates. But the approach definitely has the ability to reach scale and to support the acceleration of efforts that is currently needed for us, because as we all know that impacts are accelerating far quicker than the way that the speed at which we are responding to it. So I think everybody, from governments to civil society organizations, people involved in policy, people involved in research, people involved in practice, funders equally, because it's in their interest to get more value for their buck. So I would say that anybody who is working in this space should be interested in learning from this and using that potential to achieve scale.
Thanks, Revati. So we've now mapped out that Teach to Reach alone, one initiative amongst many others, could spark within 5 years this movement of 1 million health workers who'd be connected to each other, learning from each other's successes, lessons learned and challenges, and each taking action with their local communities to tackle these impacts of climate change and health. And so I have two questions for you. One, does that sound too good to be true? And second, who do you think should be investing in this to make it happen? Who should or who would be able to pay for the support that could spark a movement of 1 million or more health workers to make a difference in the face of these impacts?
Yeah. So I think the first answer, I would say it sounds ambitious for sure. But I don't think I don't think that it is too good to be true. I mean, if the right levels of awareness, the right levels of support is secured for an effort like this, and not necessarily just financial support, but also that momentum. Right now, since the last 2 years, since we had the first kind of COP26 Health Day, there's a lot of movement, not just in the health sphere, but also in the climate sphere and in the finance sphere, that everybody wants to, kind of put their hands on the table to find solutions for climate change and health, including nutrition. So I would say that I don't think that it is definitely ambitious for sure. And in terms of who could support such an effort, I think the first is to present this idea with a strong backing of healthcare workers, which Teach to Reach is in a fantastic position to do. And I do believe that several of the funders, particularly the ones who are inclined towards capacity strengthening of healthcare workforce for climate change and health, would definitely be interested in considering something like this. And in the interim, I'm sure organizations like ours would be pleased to join hands with others who would want to push this movement forward.
All right, thank you very much indeed, Revati. So we are at time. I'd like to ask if you're able to stay a few more minutes. We have 2 more questions for you, and then there's a question from Wajid.
Mm-hmm. Happy to stay.
All right, so let's start with Wajid's question. Is there any roadmap developed for climate change effects on health, specifically child and maternal health?
Yeah, so I would say that right now we don't have a specific roadmap. We have lots of documents which are outlining the impacts of climate change on child health, maternal health, and nutrition. In fact, last week, UNICEF should have launched their report on the same topic. So impacts-wise, I think we are covered. In terms of the roadmap for responses, we actually are standing at a unique point in time. As I mentioned, the resolution for maternal, newborn and child health and the resolution of climate change, both of these will have a global plan of action, and these will be developed now to be absorbed into the 14th plan of the work plan of the WHO, which means there will be annual reporting for the next 4 years on this topic. So it is a huge opportunity right now to get into the co-design of this roadmap. And of course, individual organizations will surely have their strategies and plans for how to achieve this. For example, we at Save the Children do have maternal and child health and climate change as a priority. We do have a policy which is in place for the last 18 months and which is being operationalized and which will carry over into our next cycle from 2025 to 2028. And I'm sure other maternal and child health organizations which are working on maternal and child health would definitely be prioritizing this as well.
Yeah. So health workers emphasize these really complex interactions in the observations they shared last July, for example, in the special event we organized between climate change and other determinants of health. And so we have Kingsley Kofi Ninyere, who's from Ghana, who highlighted, so he connected the dots between unlawful burning of rubbish, bushfires, indiscriminate dumping of refuse that have polluted the air, making breathing difficult, and that increase respiratory disorders. But then refuse dumps also serve as the breeding points for mosquitoes as well as cholera outbreaks. So what is missing to enable health systems and health workers who can see these connections, who can connect the dots? But what's missing to embrace this kind of holistic, multi-sectoral approaches that really are going to be required, are indispensable to tackle these interconnected challenges? We heard Renzo Gintos this morning telling us about planetary health. What are your thoughts on how to connect the dots and how to do so in ways that actually enable health systems to make the difference that to get the results that they were all aiming for?
Yeah, I think I will start with saying that there has been an incredible focus on direct impacts of climate change on human health. Of course, increasingly in the last 5 years, we are talking about, co-benefits of actions in other sectors that can bring benefits to health, and the other way around, actions in the health sector that can bring multiple benefits for other sectors. And there are a lot of examples from transport, from energy, from agriculture sectors where we can draw multiple benefits across these sectors. I think an inadequate understanding of exactly how much benefits can be drawn by these actions is something that we need to improve on. The dissemination of this understanding and this knowledge to both the climate scientists and sectoral scientists, decision makers and policy makers, and the health decision makers and policy makers would be the first step. And this disconnect between the sectors is mainly at the policy level. And I think we started with that first question as well, right? Like, that is there a platform where we can bring this conversation together? Now, because there is this disconnect in the policy space, this trickles down into how we understand the impacts, how we design responses, and, into the research aspect, but also into the practice level. So first of all, we need to get this joined up. From, again, at the policy level, the research level, and the practice level, but also this siloed thinking around financing, governance structures, and the implementation roadmaps, right? So all of this trickles down into nothing being joined up in terms of decision making, but also in terms of implementation. So I think that's where we should start. And again, as we go into the revisions of the national of the NDCs and then the NAPs that will come after, with these two resolutions, with the declaration, I think again we are in a unique position right now to get into these spaces, to get our voices into these spaces, so that we can correct that, we can course correct some of these intersectoral discussions, because I think the message is clear on the wall that no single sector holds the solutions for how climate change is impacting health and nutrition, and no single sector can be held responsible for the impacts. As we know, the health sector itself has a lot to do in bringing down its own carbon footprints for operations.
All right, we have a question from Caroline Akosile, who would like to know a little bit more about these resolutions by the World Health Assembly, and her conviction, or what she says in her message, is the countries can then work multi-sectorally on these. Let's hear from Caroline. Please, Caroline, do introduce yourself. Tell us who you are and what you do, and then we'll go to Revati for a quick answer to that question.
Okay, good afternoon, everybody. Good evening and good morning, wherever you have joined this noble meeting from. My name is Caroline Akosile. I am a retiree, but I volunteer for We Lead Network in Nigeria. We Lead organization whereby we work with boys, and then we also work on climate change. And she has actually touched on my question. I was just wanting her to expatiate more on resolutions by World Health Assembly, or what they have, resolved or agreed on climate change, and especially this particular topic that we're talking about this afternoon, on maternal newborn and child health. How do we relate them? Like we were talking about refuse, burning, stagnant water, mosquitoes flying all over the place, or flood that cannot take a woman who is like in labor to where she will get, have her baby safely. If we look at it, we see that all these things that are happening, impinge on not just one ministry. Not just one organization in the countries. Ministry of Environment, Ministry of Health. We can also see, like somebody had talked about Nigeria, that we have levels of government, state, local, and then the national government. So do we have resolutions that the countries can work with multi-sectorally to say, okay, all these people, they are working together to make sure that climate change does not affect the children, the women, and the newborn in an adverse way. So that's what my question is on. Thank you.
Thanks, Caroline.
Back to you.
Revati, could I ask you for a headline to sum up the World Health Assembly resolution and a one-word answer, yes or no? Do we have what's needed for countries to be able to really move forward with the global tools and support that's needed?
So the answer I can't give it in one word, but I can give it in two. Potentially, yes. Because both resolutions do talk about environmental determinants of health and, going wider sector. The climate one definitely speaks explicitly on cross-sectoral approach. The maternal one is more towards determinants of health, exactly as the colleague has outlined. And sorry, and what was your first question? A top line for?
For the World Health Assembly resolution. So what, if you had to sum up what was actually decided by all of the member states at the World Health Assembly, what is it? What's the commitment? What's the decision that was made last week?
I think the commitment is clear that there will be more effort.
More effort. Okay. Yep. And then our last question for this lightning chat, part of Teach to Reach at 10, which will be happening on June 20th and 21st. If you could ask the health workers gathered at Teach to Reach 10 one question to guide the future of climate and health action, what would that question be? Revati, either you're thinking or you've had a disconnection issue as well. And I think that might actually be the case. Yep.
Yeah. As though she's had technical issues because she's no more in the room.
Yes, and I must say, Charlotte, you and Maria had a power failure in Argentina. You have had connectivity challenges, so let's see. We don't know if she will be able to connect, so we are going to close this session just by telling you a little bit more about what to expect with Teach to Reach. So we're now, this is Teach to Reach Connect, where we will meet, network, and learn. It's the 20th and 21st of June. And here is what you need to know. First of all, is how to actually join. So you look for the Teach to Reach website. It's on the learning.foundation website /Teach to Reach. And you can see all you need to do is to request your invitation here. You can see we're now 12 days away. Put in your name and your email and click on request your invitation. You'll then receive a series of emails, and it's important that you go through, review those emails in order to be able to really get the full benefit of participation, because there are activities before, during, and after Teach to Reach. The main theme is indeed climate change and health, as you can see here. But there will be many, many other topics that will be on the agenda, including immunization, and many other topics, which Charlotte, I hope, will be able to remind me of. This has never happened before. This many disconnects from our team and our guest. And I think Charlotte is still having connectivity problems. So look on the Teach to Reach website. We'll be talking about, amongst many other topics, the 50th anniversary of the expanded program on immunization, the Movement for Immunization Agenda 2030, and neglected tropical diseases, not just female schistosomiasis, which is one of these diseases, but 21 of them, together with our partner, Uniting to Combat NTDs, is one of our esteemed partners, together with many others. I'll just, to finish, we will just look at some of the, first of all, the lightning chat with Toko Elfikpuli is already available. So that's on our YouTube channel. Let me show you that before we go. If you go to our YouTube channel, you'll see here both the live streams that are ongoing and the past ones. There are 2 already available. You can also learn a lot more about Teach to Reach by subscribing to the podcast. And this is very useful, especially if you have low connectivity. So that's www.learning.foundation/podcast. Again, all you do is put your name and your email, and then you'll receive instructions on how to connect to that podcast. We're 12 days away, and we're very much looking forward to reconnecting with you. We'll thank Revati, even though she has not been able to rejoin, unfortunately. So once again, thank you to all the Teach to Reach leaders, organizations that have become partners, and thank you for. This is the 4th year of Teach to Reach, the 10th edition. It's absolutely amazing that we've been able to keep going so far, and it is really for you, with you, and it doesn't make sense without you. All right, we do have, all right, Revati, I think, has managed to just reconnect, so I'm hoping we can at least say goodbye to you. Yeah, Revati, before we close, and thanks for making it.
My apologies. I have no idea, why internet would not support me in this wonderful chat. My huge apologies to colleagues, and happy to answer any questions from colleagues as emails or through you, Rida. If you have questions, I'm happy to respond to them later.
All right. Thank you very much indeed. This is it for this lightning chat. The next one up, I believe, I actually have to look it up. We have a link that will give you the full calendar. We'll be talking to many other global leaders who are actually interested in not just talking, but listening to you, to your questions, to your insights, to your experiences. So you can see Revati, we spoke with today. Next will be Maria Nera, Kate O'Brien, David Akpan from eHealth Africa, Luchuo Ibane, and a number of others that we have yet to announce. Once again, thank you, and we'll see you soon.